Botox 5 days ago, when eyebrows are raised, very Spock-like with one higher than the other. Will this get better or worse in the next few days? I don't want to return to original doctor as I'm worried he'll make it worse. I can't go back anyway for 2 weeks as I am going on holiday. It looks fine until my eyebrows are raised. I had Botox in frown lines and forehead. He said it was a small dose as I didn't want a frozen look. Frown lines are still there.
Thank you for your question. You submitted your question with one photo, and you state that when your eyebrows are raised after undergoing Botox 5 days prior, that you have a Spock-like appearance. And in the narrative of your question, you state that you are concerned about going back to the original doctor who did this because you're afraid it'll make the situation worse. And further, you describe that you had the Botox done in your forehead and frown lines. And the doctor had done a conservative dose so that you wouldn't be frozen. And your last sentence is the frown lines are still there. Well, I can certainly share with you my limited assessment from this photo and your history and how I would typically counsel patients in my practice when it comes to understanding what's going on with Botox. And of course, you want to know, is this going to get better or worse in the next few days? Well, to a little bit of background about myself, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Botox, Dysport, Xeomin, basically neurotoxin use in my practice has been significant and continues to grow for the duration of my years in practice. In fact, my specialty, oculofacial plastic surgery, were amongst the first doctors to use botulinum toxin. And so I've been using Botox for patients since 1993. And what I could tell you is that, of course, it is very important when I counsel my patients about the use of Botox that I try to help also convey an understanding of the principles behind what is being done. So to begin with, you had the treatment done for forehead and frown lines, and the doctor's goal was to still have some activity. Well, there are specific muscles that are important when it comes to this area, and very often it is perfectly rational and reasonable to be conservative to at least allow for some movement. A lot of times patients fall into one of two camps. One camp wants absolutely no movement at all, and the other camp wants to have some movement with expression. So one of the things that I can tell you, again, is that the anatomy is the key to understanding this. So there's a muscle that lifts the eyebrow. It's called an eyebrow elevator, and that muscle is called the frontalis muscle. And then the muscle that is responsible for the forehead lines is the corrugator and procerus muscle, and those are referred to as eyebrow depressors. Well, there's a balance that's always attempted such that you reduce the activity of the frown lines, which causes the eyebrows to go downward and inward. And at the same time, you want to minimize the exaggerated effect that can result if you don't adequately and properly in the right places relax the forehead muscles, which then in certain areas can potentially overact. And in those areas, typically you get this arching, otherwise known as the Spock appearance. Now, I understand your hesitation about going back to the original doctor, but I can tell you that in my practice, the way I deal with new patients who are doing Botox is I actually intend to see them again in 2 weeks. And the reason is that Botox has its usual effect around 3 days after injection and then has its peak effect at 2 weeks, which means that you still haven't realized the full effect of the treatment. Now, can it get better or worse? Well, it takes 2 weeks to see. And I understand that in your question you wrote that you'll be away on holiday. Now, certainly you can reach out to the doctor, and I think that it's a very straightforward issue to resolve. Basically, the lines that you see that are above the peak of the Spock eyebrows is sometimes referred to as comma lines. And it is very straightforward that you can get micro doses of Botox to allow for relaxation of some of the more superficial fibers of the frontalis muscle, while at the same time maintaining some movement of the muscle. I think for my point again about the 2 weeks follow-up is there is a process of getting to know every patient. A lot of people think of injectables like commodities where it's equal everywhere you go, like buying appliances. But the reality is there is so much nuance in doing this in a way that is right for the individual patient, and there is a get-to-know-you process that I value in helping my patients achieve an optimal look. And within the field, an ever-growing field of ways to do Botox, even in an area as straightforward as the forehead, there are actually many nuanced approaches to deliver the Botox in a way that can give you what I feel is the best result that is right for the patient. And as I was referring to earlier, there is also the nuance of microdosing and doing things in a way so that it looks natural and still get an ideal outcome. So I would say give your doctor a chance to maybe potentially help you. Otherwise, if you're still not comfortable, find another doctor who's very experienced with Botox so that you can at least deal with those comma lines. But I would recommend that you find someone that you do feel comfortable with and try to maintain a relationship so that that doctor and you get to work together on a way that will be consistent. Botox requires maintenance, and so coming in every 4 to 6 months, depending on what kind of look you want to maintain, is going to become a regular thing for you. And so you should find someone that you're comfortable with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.